So guys, in this video we will be revising the entire dermatology. So I'll be discussing almost all the high point, all the images that can be asked. So everything that you need to know for all the exam aspect I would try to discuss, guys. So just watch the video, guys, and hopefully it will help you a lot. If you have not subscribed, please consider subscribing. Okay guys, let's start. Okay guys, first of all we'll see how to approach a lesion. Okay, see, if the question says there is a white color lesion, okay, think about two things: whether it is hypopigmented or whether it is depigmented. Hypopigmented means less of melanin is there, and depigmented is means almost absence of melanin. Okay, see, if you now think about the hypopigmented, okay, see where is the site of the lesion. Either it is on the face or is on the chest and back. Okay, if the question says or the image shows the lesion on the face, okay, think whether it is on the cheeks or not. Okay, if the lesion is on the cheeks, okay, see if there is scales or not scales. Okay, if there is scaling, there are only two diagnoses. Okay, one is the pityriasis versicolor and one is the pityriasis alba. So now how will you know what is? You know pityriasis versicolor, it is caused by Malassezia furfur, okay, or Malassezia globosa. So this is a fungal organism. Okay, so how does it appear? If on fungal organism, when you try to see on Wood's lamp, it would be positive. Okay, the lesions are present on the chest and back also. Okay, and on 10% KOH, this is positive, guys. Okay, now coming on, now coming on to the next diagnosis, that is pityriasis alba. So there would be history of a child, okay, and there would be a history of atopy, means in the family history may also be present. If the lesion does not have scale, then the differential diagnosis is the intermediate Hansen. So see, intermediate Hansen is a type of leprosy, classification of leprosy. So see, the history of a child would be given. Leprosy is more common in Bihar, UP side, so history would be given. But the sensations are normal and there is no thickened nerve, guys. See, this is the photo. Normal sensation and no thickened nerve. This is the photo of pityriasis alba and this is pityriasis versicolor. Okay, now coming on to the if the lesions are present on the chest and back. Okay guys, if they have scales, it's pityriasis versicolor, the photo that I showed here. Okay, now see, if the lesion does not have scale and they are on the chest and back, then there are two things possible. One is the Hansen's disease known as the leprosy. Another is the post-Kala-Azar dermal leishmaniasis. That is actually a sequel of visceral leishmaniasis. Okay. So see, you know leprosy, what does it do? It thickens the nerve, it affects the skin sensation, and there is no history of fever. But if you think about the post-Kala-Azar dermal leishmaniasis, the sensations are normal, but history of fever would be present, and typical resident of Bihar or UP history would be given because leishmaniasis or Kala-Azar is more prevalent in this area. Now coming on to if the lesions are depigmented, guys, means the person has less of melanin, so he will appear more of white. So it may be either by birth or may be acquired through the lifetime. If it is congenital, means it's most likely to be albinism. So what is albinism? Albinism is a disorder in which there is defect in the tyrosinase enzyme, hence there is difficulty in melanin synthesis, hence the face appears more white. So what does melanin do? It prevents the harmful ultraviolet rays from being absorbed. So if the melanin is less in number, there are more chances of skin malignancy and other malignancy in the person. Okay, so where are these melanosomes located? These melanosomes are located in the stratum basal, in the melanocytes. Okay, and you need to remember epidermal melanin unit, that is 1:36. See, there are two disorders involving the albinism. One is the Hermansky-Pudlak syndrome, another is the Chidiac-Hagashi syndrome, in which there is immunodeficiency also. Hence, the patient present with recurrent infection. And Hermansky-Pudlak syndrome, here it is a bleeding disorder. Okay, and there will be albinism in this case. Also, you can see the images. See. Okay, now coming on to if the lesions are acquired depigmented. Okay, so see, if it is less of melanin, not complete absent but lesser. Okay, see, if the margins are irregular, okay, see, you can see the margins, irregular margins, then it's vitiligo. So what happens in vitiligo? It is an autoimmune disorder, means autoimmune disorder can affect other organ also. So patient may also give you a history of thyroid disorder. Okay, and other, if the margins are regular, means you have applied something and that has acted an irritant on your body, that has caused the lesion. Like example, This is the example of contact dermatitis or contact leukoderma that was due to bindi. Bindi contains an allergen known as para-tertiary butylphenol. Para-tertiary butylphenol. Okay, now coming on to the next one. So this was the possibility if the lesions were white thing. Now think if the lesions are dark in color, how will you approach? Okay. So first of all, think where is the site of involvement. Say if the site of the involvement is the face. Okay, now we'll think about the color on the face. It may be either red, it may be either brown, it may be either blue or gray. So brown lesions, there are two differentials. Okay, one is the melasma and one is the colasma, one is the chick side. So melasma, so what happens, this melasma, you can see the brown color pigmentation. Okay, so there is a history of OCP use, okay, oral contraceptive pill, or history of pregnancy or a female. In female, this may occur during the pregnancy also. Okay, now see here what you see, there is a brown color pigmentation on the tip of the nose, guys. Okay, so this brown color pigmentation on the tip of the nose, and the patient presenting with a typical history of fever, joint pain, arthralgia. So what does this suggest you towards the diagnosis of chikungunya? Okay, and this typical sign is known as the chick sign. Okay, now coming on to the next one. Okay, now if the lesions are blue or gray in color and it appears on the face, see if it appears on the cheek, okay, so that is basically nevus of Ota. So what will the history, typical history they will give? They'll give history of congenital, that it is present by birth. Also when you look at the sclera, it will appear white. See, there are two type of nevus. One is the nevus of Ota and one is the nevus of Ito. See how to differentiate it. You may differentiate based on the location. Okay, see if you remember Ota, how can you remember it? Ota can be remembered as ophthalmic branch of trigeminal. Means it involves the face area. You know trigeminal nerve, as the name indicates, there are three branches: ophthalmic, maxillary and mandibular. Okay, so this involves mainly the ophthalmic and the maxillary branch. You can see the distribution of the lesion. Do you see it? See, now coming on to the lips. If the lesions are on the lips, that suggests a fixed drug eruption, and it is, see, you can look, it's blue to gray in color. Okay, so there would be history of drug uses. Okay, now coming on to if the lesions are red. Okay, if the lesions are red, again it may be congenital, that is present by birth or may have acquired over the course of time. If it is congenital, okay, so there is a pot wine stain. See, you can see pot wine stain. Okay, so this is seen in Sturge-Weber syndrome. And Sturge-Weber syndrome, what do you see? You see tram track calcification. This is important from the MCQ aspect. Okay, now coming on to if the lesions are acquired. Okay, it may be either three of the possibility. What can it be? It can be either SLE, maybe either rosacea, maybe either dermatomyositis. SLE, systemic lupus erythematosus. What does name it? This causes systemic manifestation. And lupus is like a wolf, so you can see like butterfly rash on and it spares the nasolabial fold. Okay, see, now there is rash, there is systemic feature, and you will find alopecia. Alopecia I'll further talk about, you will find, and palatal ulcers. Okay, so 4 out of 11 criteria must be present in order to diagnose a patient with SLE. Now coming on to the rosacea, see this photo. What happens, it looks like a potato nose, okay, or potato tumor. This is also known as rhinopyma. So there are flushed cheeks, it appears more red, and dilated vessels. Okay, and steroids are contraindicated in this. Now coming on to the dermatomyositis. Okay, so what happens at dermatomyositis, patient gives an history of proximal muscle weakness, means hip and other muscles, and there would be presence of three features. See, the rash that you see here on the cheek, that is heliotrope rash. Okay, and here on the fingers you see Gottron's papule, and this is the Sol sign that you see in the patient. Okay, now coming on to if the lesions are present on the shoulders and shoulder or the arm. Okay, so two possibilities are there. We'll check out the color. Either it is blue or it is black. We know that nevus of Ota was also blue, so Ito will also be blue. See, but where does the lesion appear? See, nevus of Ito lesion appear on the shoulder or the arms. Okay, now coming if the lesions are brown. See this color. So what do you notice in the picture? It appear brown. B is for Becker, B is for brown, and B is for everything in excess. That more hairs are present. You can see, compare this photo and compare this photo. How many extreme excess of hair is present. Okay, now see, if the lesions involve the flexure. Okay, so there is lichen planus. So lichen planus, you know the presence of 5 pits, purple, pruritic, plain top, papule, plex. Okay, and pruritic means it's itchy. Okay, so guys, and no scaling would be seen. Now see, if the lesions are present on the lumbosacral area, okay, so this is known as Mongolian spots. And what is the typical feature? It resolves in 6 months to 1 year. Okay. So guys, this we talked about now the white lesion and the dark lesion. Now we'll talk about further about the blisters. Okay, like if the blisters are flaccid or the blisters are tense. So guys, understand how can you think about the flaccid and the tense blister. This layer of skin, it is divided into epidermis and dermis. Like what? And dermis is further divided into papillary dermis and the reticular dermis. And this epidermis has 5 layers. Recall with me, guys. What is the mnemonic? Come, let's get sunburned. C is for stratum corneum. L is for stratum lucidum. And G is for stratum granulosum. Again, S is for stratum spinosum. And B is for stratum basal. Okay, see guys. So if the lesions are there in the superficial layer, what will happen there? Means the skin below it, skin above it is not very tense. Okay, that is flaccid bulla. If it is located deeper down, that is known as tense bulla. Okay. Now coming on to the flaccid bulla. Okay, so for flaccid bulla we have 3 things. That is pemphigus vulgaris, pemphigus foliaceus, and staphylococcal scalded syndrome. So in pemphigus foliaceus, the level of split is the subcorneal split. Okay, so the split is just beneath the stratum corneum. Okay, so see, it's so superficial that above it just you have the stratum corneum. So see, there would be crusting, there would be erosion, and this pemphigus foliaceus, it involves only DSG1. Okay, foliaceus is the first, F for first, F for 1, and 1 is also first. Okay, and there is a history of adult. Okay, and it also involves the seborrheic areas. Now coming on to the pemphigus vulgaris, it involves both DSG1 and 3. This DSG3 is present in the mouth. Hence, along with skin ulcer, you will also find the presence of oral ulcer. And you can see the blistering. Okay. Now coming on the staphylococcal scalded skin syndrome, as the name is says you, there is a scalding of skin, that is separation of the skin. So there would be scalded appearance. Okay. In a child, history of child is there, and the child presents with a history of fever. Okay. Now coming on to the tense blister, it may again be either congenital or maybe acquired. Okay, if we talk about the congenital one, okay, this is either epidermolysis bullosa junctionalis or epidermolysis bullosa dystrophica. For junctionalis, you can remember J looks like 5. Okay, means there is laminin 5 mutation. And if you talk about dystrophica, so there is collagen 7 dystrophic. Okay, remember like this. Now coming on to the acquired blister, guys. Okay, so what are the DDs possible? It may be either because it is located deeper to the epidermis. Okay, see. So there are bullous pemphigoid, dermatitis herpetiformis, or linear IgA dermatosis. See, these are basically the bullous pemphigoid are seen in old age and they are itchy. Okay, see, you can see the photo of bullous pemphigoid. You can see how tense bulla does it look. Do you think, guys? So what is the mutation in this? It involves BPAG1 and BPAG2. Remember this one. This is first, so the value is more. That is BP230 and BPAG2 is BP180. Okay. Now coming on to the dermatitis herpetiformis. See, dermatitis herpetiformis, there is a typical history of involving the extensor, and the rashes are itchy or pruritic, and you can see there is a grouped erythematous lesion. Okay. And when you do a immunofluorescence, what do you see? You will see IgA deposition at the papillary tip junction. Okay. Now coming on to the next one, that is a linear IgA dermatosis. So this what is defined as typical cluster of jewels appearance. Okay. Now coming on to the congenital. So congenital, there are 2 things. Okay. Epidermolysis bullosa simplex. That is mutation in the keratin 5 and 14. This is the important MCQ. Now next one is the Hailey-Hailey disease. Okay. So Hailey-Hailey disease, you have a mutation in ATP2C1. Do you see? It involves the flexural area. See how the flexors are getting involved. And what is the mutation? ATP2C1. See. And how does it looks like? It looks like a dilapidated brick wall appearance. This is a very important MCQ. Okay, guys. And also you have one more disorder, that is Darier's disease. Remember what is the problem here? That is ATP2A2. Darier. How can you remember? DA. D is 4th letter. 2 into 2 is 4, or 2 plus 2 is 4. And A remains like this. Okay, guys. Now coming on to what are the findings that you will see. Okay. If you talk about the pemphigus vulgaris, this is the most frequently repeated MCQ again and again, guys. So do not make any mistake, guys. It is basically deposition of IgG in the fishnet pattern. Okay, guys. Now coming on to the bullous pemphigoid. I said bullous pemphigoid is located deeper, guys. So there is linear deposition. Okay, that was epidermal deposition. That was linear deposition, guys, along the basement membrane. Okay. Now coming on to the next one, that is dermatitis herpetiformis. That is granular deposition of IgA. Both other places we saw IgG deposition. Okay, and bullous pemphigoid IgG in C3. Okay, guys. Now coming on to the differentiating between pemphigus vulgaris and foliacea and pemphigoid. Think pemphigus vulgaris means it was more superficial. Means there would be flaccid bulla, guys. Here it was more deeper, hence there would be tense bulla. Okay, this bullous pemphigoid, I said it is seen in pemphigoid. Name में old आ रहा है. So means it is seen in older population. This is seen in vulgar people, young people, slightly more vulgar, you know. So it is seen in younger. So see, where is the problem? Okay, I said pemphigus vulgaris both against DSG3 and DSG1. Okay. And this is against hemidesmosome. This basically hemidesmosomes are only BPAG1 and BPAG2, which I talked about. Where is the location of the blister? See, I said it is intraepidermal, means within the epidermis, and this is below the epidermis. Hence, they are deeper blister. Hence, they are tense blister. Hence, on Nikolsky, when you try to rub, it won't. The skin won't go away. Means it's Nikolsky negative, and this one is Nikolsky positive. And the bullous pemphigoid, the prognosis is more favorable. Okay, guys. Now coming on to the next one. How do you approach a case of genital ulcer, guys? See, whenever a patient presents with you a genital ulcer, ask him whether the ulcer or the lesion is painful or painless. If the lesions are painful, you have two TDs. What are the TD? Look at the if the presence of vesicles are there or not there. If the vesicles are there, it is chancroid. And how is chancroid caused? It is due to Haemophilus ducrei. So Haemophilus ducrei causes chancroid. How will you remember it? Chancroid makes you cry. Okay, so this makes you cry, guys, means there is pain. Okay, there would be multiple ulcer, and it is soft and it bleeds on touch, guys. Okay, now coming on to the if the vesicles are present is herpes, and if it is not present is chancroid. Okay, guys, I made a mistake while making the notes, guys. Okay, see, guys, now if the vesicles are present, so it is herpes infection. Herpes, it is recurrent infection, and you remembered how do you treat herpes with the help of which kit? That is kit number 5. So kit number 5 was which color, guys? Red color, and it is most common STD. You remember I said about in the dermatological STD kit must know point, the video that I posted, that it is in kit 5, it is most common STD, and you don't require any partner treatment, guys. Now coming on, if the ulcer is painless, guys, if the ulcer is painless, you have 3DD, guys. Ask about two things. Ulcer is painless. Now ask about lymph node, whether the lymph nodes are painless, whether the lymph node are painful, or whether there are no lymph node. Okay, see, how will you remember it now, guys? Painless ulcer with painless lymph node is syphilis. Okay, so how syphilis is hard ulcer, and it is single and it does not bleed on touch, guys. Now coming on to if the lymph nodes are painful, guys, that is lymphogranuloma venerum. So lymphogranuloma venerum, group sign positive, and it causes the bubo. Now try to revise, guys, that day we read for which color kit we use for bubo, that is black color kit are used for bubo. Now coming on to the donovenosis, that is there is no lymphadenopathy. Okay, so it bleeds and there is presence of pseudobubo. Okay, so now, guys, whatever we read about genital ulcer, we would like to revise it in the form of a table so that it's become more easy for you to revise. Think about chancroid. Chancroid causes soft chancre. Hard chancre was caused by, guys, that was syphilis, that causes hard chancre. Okay, see, so chancroid was caused by Haemophilus ducrei, which shows school of fish appearance. Okay, guys, see, how are the lesions? Chancroid makes you cry, means the lesions are painful and they are indurated. Okay, the inguinal node is tender. Okay, and how do you treat it? It is treated with the help of azithromycin and ceftriaxone, guys. Okay, now coming on to the other one, that is herpes. You know herpes, so most commonly the lesion is in the genital. You know there are two herpes, HSV1 and HSV2. HSV1 causes lesion above the breast. waist and HSV2 below the waist, means it's most likely HSV2 more than one. I said there are two painful conditions, that is herpes and chancroid, okay, and there would be multiple grouped vesicle, guys, okay, and pain would be present, okay guys, painful lesion. How do you treat acyclovir? Kit 5, that is red in color, and you do not require any partner treatment, okay guys. Now coming on to the syphilis. So syphilis, that is due to Treponema pallidum, okay guys, that is a spirochete. Syphilis, painless ulcer, painless lymph node. See, that is not tender lymph node and there is painless. And syphilis is single ulcer, okay, with a clean base, guys, okay. So how do you treat syphilis? It is done with benzathine penicillin, penicillin G 2.4 million unit. Which kit was this, guys? Remember, kit 3. What was the color of kit 3? That was white in color, guys, okay. Now coming on to the lymphogranuloma venereum. So this lymphogranuloma venereum is caused by Chlamydia trachomatis. Okay, I said this is a painless ulcer, but lymphogranuloma is painful lymph node. I said you guys see, and this is positive. This is the important MCQ, that groove sign is positive in lymphogranuloma venereum, guys, okay. How do you treat lymphogranuloma venereum? You can use doxycycline or you can use erythromycin, guys, okay. See, now coming on to so basically this azithro and doxy, they belong to the kit number 7, that is black color, guys. So do revise the video if you have not seen that video, how to remember the kit and the drug, okay. Now granuloma inguinal, known as donovenosis. It is caused due to Klebsiella granulomatis. So how does it basically cause? This is formerly it was known as previously Calymatobacterium granulomatis. Okay, see, so this is painless. I said all the three are painless ulcer, but and the lymph node, there are no lymph node, okay. And on if you do the stain, it shows the presence of Donovan's body. And treatment, again, it is azithro and doxycycline, guys. So we are done with the sexually transmitted disease, the ulcer. Which one is painful, which one is painless? Groove signs are seen in lymphogranuloma venereum, guys, okay, and Donovan bodies are seen in donovenosis, guys. A herpes will say Cordry type A body, and school of fish appearance would be seen in chancroid caused by the Haemophilus ducrei, and this is the groove sign that you see in the photo, guys, okay. Now coming on to the alopecia. Okay, so see, alopecia, you have two types of alopecia. One is the scarring alopecia, one is the non-scarring alopecia. So in case of non-scarring alopecia, prognosis is better because hair regrowth is better. First, we'll talk about the scarring alopecia. See, this tinea capitis, this can fit anywhere into scarring and non-scarring. Like you cannot classify. See, I have written at both the place like tinea capitis. Do you see, guys? It can fit anywhere, guys, okay. Now coming on to the discoid lupus erythematosus. What will it show? It will show the presence of discoid plaque, and carpet tank sign would be positive. See, if you talk about the scales, you need to remember 3 signs in scaling. What are the 3 signs? One is the auspice sign. Remember, guys, try to recall, where do you see auspice sign? It is seen in psoriasis. What happens in psoriasis? When you try to scratch the lesion, okay, initially you have a membrane known as the Bulkley's membrane, guys, okay, and there would be multiple pinpoint bleeding, okay, which is present in psoriasis, okay, guys. Now coming on to the carpet tank sign, okay, when you try to scratch the lesion, okay, when the scale is removed, under surface shows horny plaque. This is present in DLE, diffuse lupus erythematosus. Now coming on to the other sign seen in scaling, that is the scratch sign, okay. This is also known as Coop D angle sign or Biesner sign, okay, guys. So where this sign is seen, guys? This sign is seen if the lesion is scraped with a fingernail, guys, okay. So it is present in pityriasis versicolor, guys, okay. Now coming on to the scarring alopecia other cause, that is lichen planopilaris. So what happened, guys? It looks like a footprint in snow appearance, guys. You see, footprint in snow appearance, guys. So this is also known as pseudopalade or Brocag, okay, guys. Now coming on to the non-scarring alopecia. So we have typically 5 causes that I have written. Androgenetic alopecia, guys, see, this is basically due to alopecia means loss of hair, okay, and due to androgen sensitivity, okay. See, if there is frontal hair recession, this is more common in males, okay, and this is in accordance with the Norwood Hamilton classification, guys. Okay, now coming on to the trichotillomania. So this is the basically a impulse disorder, yeah, and in this the patient has the urgent urge to pluck the hair, and if you see the alopecia patch, there would be varying length of hair present on the patch, okay. Now coming on to the alopecia areata. So alopecia areata is again an autoimmune condition. Remember the one other autoimmune condition that we read today. What was it, guys? Recall, guys. Okay. So there is loss of pigmented hair, and it spares the white hair. Okay. So there is no problem in the white hair, guys. Only it spares the white hair, and this is very important, guys. In alopecia areata, you see the exclamation mark here. In tinea capitis, you see the comma here. And in trichotillomania, you see the normal hair with black dots. Okay. Now coming on to the secondary syphilis. This is very important from MCQ point. Moth-eaten alopecia is seen in secondary syphilis, guys. Okay. Now coming on to rapid revision of dermatology, we'll see some important images and some notes. Okay, guys. See, you can see the presence of lacy stria, guys. This is due to hypergranulosis. Okay. And this is seen in lichen planus, guys. Okay, guys. Don't miss out this photo. See, this photo we already discussed. There is a dark color spot in the lumbosacral region, guys. What is your DD, guys? That is Mongolian spot, guys. If it is so, you can remember, guys, we talked about the dark lesion in various aspects, guys. If it was in the flexor, it was lichen planus. If it was on the face, we'll classify it on the color. Either it was blue color, either it was brown color, or it was red in color. Red color again had 3 DDs, guys. Okay. See, this is alopecia areata. There is patchy hair loss, guys. This is psoriatic arthritis. How will you identify it, guys? See. So this involves psoriatic arthritis. See, you will see micaceous or silvery scale, guys. Okay, and why does it appear silvery? Because the layer of air get trapped between it. And this psoriatic plaques or psoriatic arthritis, they are HLA-B27 positive, guys. Now coming on to the SLEC, we have already discussed this photo, guys. Butterfly shaped rash. Okay, and if you see herpes zoster, you can see this is along a dermatomal distribution, and this is due to recurrent activation. Okay, latent herpes get reactivated, guys. Okay, now coming on to the some of the important topic that is very important here. Okay, see, first of all, father of modern dermatology is Thomas B. Fitzpatrick, guys. Okay, see, so skin, I said there are 3 layers: epidermis, dermis, and the subcutaneous layer. I said there are 5 layers in the epidermis. That was come, let's get sunburned, guys. Okay. Now coming on to the epidermal turnover time. That is skin doubling time. That is around 56 days. Okay. In psoriasis, what happens? This time is reduced to just 4 days. Means skin will double in just 4 days, guys. Okay. Now coming on to what are the cells present in epidermis. Okay, so we have keratinocytes that are mostly majority. Okay, then melanocytes present in stratum basal, this Merkel cells, and we have Langerhans cell. You might have remembered there is a term known as Langerhans cell histocytosis, guys, which was CD1A, CD207 positive, tennis racket appearance on electron microscopy, Birkbeck granules being seen, guys. Okay, now coming on to the layers. Okay, stratum basal. Okay, it has mitotically active keratinocytes. Also, it will have melanocytes, guys, because stratum basal contains melanocyte. Okay, now coming to stratum spinosum. This stratum spinosum is the thickest layer, guys. Spinosum or spines are seen. Okay, so this is also known as prickle cell layer, guys. It contains multiple protein like cadherin, plaquin, desmoglein. You remember we talked about desmocoilin, now placophilin, placoglobin, guys. Okay, and this is an important MCQ. What is Malpighian layer? Okay, if stratum spinosum and stratum basal together are known as Malpighian layer, guys. Now coming on to the stratum granulosum, think what does name say? There is the presence of granules. So what are the granules that are present? That are the keratohyalin granules, guys, or lamellar membrane, or also known as Odland bodies, guys. Okay, see, keratohyalin granules synthesize preflagrin. Okay, so if there is flagrin deficiency, that is ichthyosis vulgaris, that is there is fish-like scales, guys. Okay. Now coming on to lamellar body, they synthesize the lipid. Okay, so where are they present? They are present in the skin, and type 2 alveolar cells that synthesize, guys, surfactant. Okay, I said about waist-shaped hypergranulosis, means granulosa layer stratum granulosum has got hypertrophy. This were the reasons for Wickham striae. Remember, guys, we saw the photo of Wickham striae that were lazy lesions present all around the mouth. Okay, now stratum lucidum. This stratum lucidum is present only in thick skin, guys. It's not present always. So this has translucent cell, lucid. Okay, and there are refractile granules of E-leadin. Okay, guys. Now coming, this layer is present in palms and soles. Now coming on to the stratum corneum, that is the outermost layer, guys. Okay, this is deficient in low birth weight or premature babies, guys. Okay, if the baby is delivered after 35 weeks, okay, so which layer may be absent? That is stratum corneum. So this may be asked in a MCQ aspect, combining the peds part, derma part, so it can be asked, guys. Okay, this is mainly made up of dead keratinocytes. Okay, now coming on to the some important term, if there is presence of nucleus in the stratum corneum, that is parakeratosis. P for parakeratosis, P for presence of nucleus or retention of nucleus. It is seen in psoriasis, actinic keratosis, seborrheic dermatitis. Okay, guys, eczema. Remember PEAS, PEs. Okay. Now coming on to keratinocyte. Where does it originate? It originates from the ectoderm. Okay, guys, keratinocytes originate from ectoderm. Okay, guys, I said about you have keratin 514, and what does it mutation cause? Remember, guys, I said that is epidermolysis bullosa simplex. Keratin 818. Remember, guys, I talked about in pathological body. So this is basically present in the hepatocytes, seen in known as Mallory Dank bodies, guys. Remember, I talked about this, guys. Now melanocyte. Okay, I said melanogenesis means formation of melanin takes due to the amino acid tyrosinase. If there was a deficiency, we talked about a disease known as albinism. Okay, so basically there is like confusion that it arises from neural classes, on it arises from neural classes, guys. See, melanocyte present in stratum basal, and one melanocyte, okay, transferred it to 36 keratinocyte. This is known as epidermal melanin unit. This is the reason for uniform skin color, guys. Okay, now coming on to the Merkel cell. This Merkel cells, guys, it originates from ectoderm, okay, more than neural crest cell, guys. Okay, so these are also known as Hassa-Bacon cell. Okay, guys, so they are again present in the basal layer. Now think, guys, in basal layer you have 2M. What are the 2M, guys? One is the Merkel cell and one is the presence of melanocytes, guys. Okay, so see, if you talk about the touch receptor, they are small, they are slow adapting receptor, and they are rapid adapting receptor. See, you know that now MRF tires are the best, guys. So they are slow tires, means they can adapt better. They will have a long lasting, guys. M for Merkel cell, R is for Ruffini ending, and F for free nerve ending, guys. Now coming on to the rapidly acting, okay, there are hair and organ, they are Meissner's corpuscles or Pacinian corpuscle. Think, guys, they are Meissner's, pacing, and they are pacing, racing, guys. So they are rapidly adapting, guys. Now coming on to the Langerhans cells, that is due to the mesoderm. This is an important MCQ. So these are APCs, that is antigen presenting cells, present mostly in the stratum spinosum, guys. Hallmark, I said Burbeck granule, that was tennis racket appearance. What are the markers? CD1A, S100 and CD207, that is Langerhans, guys. Okay, so decrease in Langerhans cells in psoriasis, sarcoidosis. Okay, guys. Now see, if you talk about the Langerhans cell, okay, there are 3 subtypes, guys. Okay, one is the eosinophilic granuloma, other is the Hand-Suller-Christian disease, guys, and other is the Litter-Sieve disease. The only thing that is important is the Hand-Suller-Christian disease, guys. Okay, so how can you remember it? You can remember it like I am born a Christian and I'll die as a Christian, guys. Hand-Suller-Christian. Okay, guys, see. How will you remember? Born a Christian, die a Christian. See, bone can be remembered, multiple bony defects. Okay, guys. Die. DI for diabetes insipidus and E for exophthalmos, guys. Okay. Now coming on to the important nuggets. Okay, that is important to know. Yeah, that may be asked for MCQ. See, if there is a stomach malignancy, they may go here known as the lesser Trelat sign. This is the classical image you will see everywhere. So this and this actinic keratosis, which shows the presence of parakeratosis. What was parakeratosis, guys? Recall it, guys. That is presence of nucleus in the stratum corneum. It is a pre-malignant condition, guys. Okay. This seborrheic keratosis, that is keratotic plaques. Okay, and there is sudden appearance of this lesion. This is associated with gastric adenocarcinoma, guys. Now acanthosis. Okay, these are some of the important terms like parakeratosis. Another thing, that is thickening of the stratum spinosum is known as acanthosis. Spongiosis, that is fluid filled accumulation in the stratum spinosum. Dyskeratosis means if the keratinization is abnormal. So it may be seen in squamous cell carcinoma, Darier's disease, and Haley disease. Remember, guys, Darier, what is the gene mutation? ATP2A2, and Haley disease, ATP2C1. Okay. Now coming on to the micro abscess, guys. What are the abscesses that may be found? Okay, so there may be neutrophilic micro abscess, there may be lymphocytic micro abscess, guys, and there may be eosinophilic micro abscess, guys. Okay, see, this Portreus micro abscess is found in mycosis fungoides, and this Munro's micro abscess is found in psoriasis, and also the spongiform pustules of Kogos are also found. So how do you remember? M is not for M, means Munro's micro abscess is for Munro micro abscess is in psoriasis, and this P is not for P, means Portreus will not go to psoriasis but will come to mycosis fungoides. Okay, guys. And neutrophilic, you have also papillary tip microabscess, that is dermatitis herpetiformis. Remember how were the lesion? They were grouped lesion over the extensor aspect that were gluten sensitive, guys. So what you avoid? Avoid barley, rye, oat, wheat. This eosinophilic microabscess is seen in pemphigus vegetans, guys. Okay. Now coming on to the Zank smear. Okay, so Zank smear is basically done to look for herpes and other cause. Okay, see, if there are multinucleated giant cell with molding and other feature, that is most likely a case of herpes, guys. Okay, now talking about acanthocytes, means the cells that separate out. Okay, that is seen in pemphigus, guys. Okay, if there is dyskeratotic keratinocyte, that is seen in Darius disease. I said Darius disease, ATP2A2. If there is necrotic keratinocyte, that is seen in epidermal necrosis, that is Stephen-Johnson syndrome or toxic epidermal necrolysis. Now coming on to the structure of dermoepidermal junction, guys. Okay, if you talk about the structure of dermoepidermal junction, guys, so see, first of all, look at the structure. We have talked maximum things. See, keratin 5 and 14 mutation cause epidermolysis bullosa simplex. Now this comes to the structure of hemidesmosome, BPAG1 and BPAG2. Okay, BPAG1 is bigger, hence 230. 2 is smaller, means one is bigger, it's 230, and 2 is 180, guys. Okay, and there are other parts also like plectin, integrin, lamina lucida, lamina densa that contains collagen 4, and this collagen 7. See, this also we have talked about bullous pemphigoid and epidermolysis bullosa dystrophica, I have also said, and we have also talked about laminin 5 gene mutation, guys. Okay, guys. Now coming on to the dermis. Dermis, I said, is two part, that is made up of collagen, and collagen 1 are more than collagen 3, guys. Okay, and ratio is almost 9:1, guys. Okay, 8:1 to 9:1, guys. It has two layer. Okay, papillary dermis and the reticular dermis, guys. Now coming about all the Darius sign that you see in dermat, guys. See, this is very important, guys. This Darius disease, see, that is calcium ATP gene defect, guys, I said, and this is a intraepidermal blistering disorder due to mutation in. Okay, now see, Darius sign. If you rub the lesion, guys, okay, this is seen in c-KIT mutation. Okay, so this is seen in urticaria pigmentosa, it turns white. Okay, urticaria is basically the eosinophilic reaction, guys. Now comes the mutation in c-KIT, also known as CD117. Okay, guys. So where it is seen? Games is the mnemonic. You play any game with the help of a kit. Okay, so G is for just. Okay, A is for AML. Okay, guys, M for melanoma. Okay, guys. Now coming on to the pseudo-Darius sign. Okay, this is seen in smooth muscle hematoma due to piloerection, guys. This may be asked as a MCQ. Okay. Now for subcutaneous layer, what is important, guys? That is erythema nodosum, and that is erythema induratum, guys. Okay, see, this erythema nodosum, they are seen in anterior part of leg, and this induration is seen in posterior part of the leg, guys, due to Mycobacterium hypersensitivity. So what are the causes of nodosum, guys? Okay, see, and this do not ulcerate. NO means no cause, idiopathic. DO matlab drugs like OCPs, drugs OCP. S is for sarcoidosis, S is for streptococcal infection. U is for ulcerative colitis or Crohn's disease, M is for MTB, guys. Okay, now see, now coming on to the appendageal disorder of the skin, guys. So what are the disorders of appendages that we can talk about? Okay, so if you talk about how does hair goes, okay, guys, see, hair cycle, how does it go? You have three phases. Remember, hair is acting. A is for anagen, C is for catagen, and T is for telogen. Okay, so what happens in the three phases of the hair cycle, guys? How does hair grow? So anagen, this is basically the growth phase, guys. Okay, this catagen phase is the transition phase, guys. Okay, or the involuting phase, and this telogen phase, guys, is the resting phase. Okay, so how will you remember how does it last? Okay, guys, see, this anagen phase is for 3 years, This is for 3 weeks and this is for 3 months. See, remember ACT, month, week, year. Okay, guys. See, growth phase, involution phase, resting phase. This anagen phase has maximum 85%. Okay, this has 1%, and this telogen phase has 15% here, guys. Okay, now we'll talk about where is the location of the stem cells. Okay, guys, this is important. Okay, this location of the hair stem cells. Okay, this is in the Adam's fringe, that is the bulge area, guys. For the brain, that is subventricular zone and dentate gyrus, guys. For cornea, it is the limbus, guys. Okay, corneoscleral junction known as the limbus. For intestine, it is the Paneth cell, and for liver, it is the canal of hearing, guys. Okay, now coming on to the disorders of the hair, guys. So now if you talk about the hair disorder, guys, see, you have two things: anagen effluvium and tenogen effluvium. Think, guys, anagen is the growth phase of the hair. So now the growing hairs have started to shed off. How will it shed off? If you start chemotherapy, guys. Now telogen effluvium. Telogen effluvium was the resting phase, guys. So it occurs 3 months after, like if you have prolonged illness like pregnancy, typhoid fever, chronic illness, guys. Okay. Now coming on to the alopecia, guys. So see, there are two types of alopecia, guys: androgenic alopecia or alopecia areata, guys. See, this androgenic alopecia, okay, so the main problem is with the androgen enzyme, that is dihydrotestosterone, and this alopecia areata is a patchy condition. See, how can you see? There is a patchy hair loss, guys. Okay, and it spares the white hair, guys. Okay. What does histology? So histology will show in alopecia areata, around the follicles there would be lymphocytic infiltrate. So what does it know? Perifollicular lymphocyte infiltrate, which is known as swarm of bees appearance, guys. Okay, see, and generalized phototherapy is used for treatment. See, if it involves the entire scalp, that is known as alopecia totalis, total scalp gone. Okay, if it involves the body, guys, it is known as alopecia universalis. Okay, see, you may see there are two terms written. One is the ophisiasis and one is sisiafo. Okay, this ophisiasis, that is loss of temporal or occipital hairline, and this is sisiafo, that is loss of hair from the frontal hairline, guys. Okay, so what is the treatment of choice, guys? Immunosuppressants like steroid, okay, and topical clobetasol. Okay, guys. Azathioprine, it is a steroid sparing agent or topical calcineurin inhibitor, guys. Now coming on to the pattern hair loss. Okay, guys, so see, if you talked about it, maybe either male pattern, maybe either female pattern. Male pattern is given by Hamilton-Norwood classification, and female pattern is given by Ludwig classification or the Olson classification, guys. Okay, see, treatment, what will you give? You will give minoxidil, that is potassium channel opener, and type 2 5-alpha reductase inhibitor, that is finasteride, guys. This is very important, guys. Okay, or you may do a follicular unit extension, FUE, guys. Okay, these occipital hairs are used for follicular unit extension. Why? Because they are androgen insensitive hair, guys, so they won't respond, guys. Okay, now coming on to the other important nuggets, guys. See, now we have talked about the nail pitting, guys. See, so psoriasis, you see the presence of nail pitting, guys, but these are irregular and deep pits in psoriasis, guys. Okay, also known as thimble pitting. If you talk about regular and superficial geometric pitting, that is seen in alopecia areata, which was the autoimmune condition where we talked about the patch of loss and exclamation mark sign on trichoscopy, guys. Okay. Then next is the trichotillomania, guys. We have already talked. Just to see, there is a patch of hair loss, guys. Okay, with variable length of broken hair follicles. I talked about this, guys. Histology will show no inflammation. Okay, but there would be perifollicular hemorrhage. While in alopecia areata, there was perifollicular inflammation known as swarm of bees appearance, guys. And this is the behavioral disorder. I said impulsive disorder. Hence, you need to give a behavioral therapy. Now coming on to the pseudopalade of Broca, guys. I said about pseudopalade of Broca, there was footprint in the snow appearance, guys. That is seen in lichen planopilaris, guys. Okay. Now coming on to the alopecia, non-scarring alopecia and the scarring alopecia, guys. Okay. This non-scarring alopecia, that all the things that involves A wala, anagen effluvium, alopecia areata, androgenic alopecia, tenogen effluvium, trichotillomania, secondary syphilis. I talked about moth-eaten alopecia, guys. This is important from MCQ as well. And SLE may be seen both. This SLE and tinea capitis may be seen in both the places, guys. Okay. Now coming on to the scarring alopecia. Okay. So in scleroderma, there may be linear scalp morphia. Okay, this is known as in-cop D Sebre sign, guys. Okay, and we have also talked about Scop D angle sign known as Biesner sign, guys, in pityriasis versicolor. Now it may be seen in Phoebus. It may be seen in lichen planopilaris, guys. It may be seen in discoid lupus erythematosus or pseudopallid of Broca, guys. Okay. Now coming on to DLE and nails, what are the important things to know? Okay, DLE, this is always scarring alopecia, guys. See, we talked about the scarring alopecia. DLE shows scaly lesion, guys. It aggravates on some exposure, discoid lupus erythematosus. I said carpet tank sign. I said about the scaling sign, auspice sign, carpet tank sign, and Cobb angle sign, guys. When you remove the scale, there are prominent follicle. And treatment is hydroxychloroquine, guys. Okay, now if you talk about the nail, okay, there is nail matrix shows two portion. One is the proximal portion, guys, and other is the distal portion. This proximal portion that you see actually forms the dorsal portion of the nail plate, guys. Okay, and this distal portion actually forms the ventral portion, guys. Okay, so I said about nail pitting: regular, no, irregular, regular in alopecia areata, irregular and deep pits in psoriasis. Nail pitting is due to focal parakeratosis of the proximal nail keratis. Okay, see, this onychomycosis means fungal infection. That is most common site is hyponychia, guys. Okay, and infection of the nail fold is known as paronychia, guys. It acute in S aureus and chronic in candidiasis. This is the important MCQ, guys. Okay. Now coming on to the leukonychia, guys. Okay, this leukonychia, guys. So leukonychia is basically white color. Okay, apparent leukonychia. So terry nails that is seen in hepatic failure or chronic liver failure, guys. Okay, half and half nails. Okay, that looks like this. Half and half nails look like this, guys. That is Lindsay nail, also known seen in chronic kidney failure or chronic renal disease. Now Murky nail that is seen in hypoalbuminemia, guys. Okay, now coming on to the sweat gland and the sebaceous gland. Okay, so see, we have eccrine gland and we have apocrine gland. Okay, apocrine gland, remember, when you remember like apocrine gland, remember this mammary gland is apocrine gland. So it has duct that open on the tip, guys. Okay, opens along with the hair follicle, guys. Okay, say axilla side, areola, milk areola complex, and groin has the apocrine gland. And there is adrenergic control, guys. In apocrine shows adrenergic. This acrine gland, this directly open over the skin surface, guys. Okay, it can be located anywhere, everywhere. Normally this gland is only located. Acrine has ECC, that is cholinergic control, guys. Okay, and if you talk about the disorder, guys, okay, though there is an apocrine gland ABC. B is for bromhidrosis and C is for chromhidrosis, guys. Okay, and there is Fox-Fordyce disease. Okay, so this is present in female in second decade, guys, and there the lesions are itchy. Okay, and there are other apocrine defect, that is hidradenitis suppurativa, guys. Okay, now see, we have disorder, acrine gland disorder is malaria. This is important from MCQ. They may ask, malaria is a disorder of, so this is a disorder of acrine gland. Okay, see, so there may be types of malaria. We don't need to remember, guys. That's not much of importance. Okay, now coming on to the sebaceous gland. We have talked about the sweat gland, acrine and apocrine. Now this sebaceous gland, if there is alone, okay, if there are ectopic sebaceous gland on the lips, this is known as Fox-Fordyce spots, guys. This is very important. You can see mainly on the upper lip. In areola, what does it do we call this? Montgomery tubercles, guys. In glands, it is known as Tyson's gland, guys. And in eyelid, it is known as Meibomian gland, gland of Gis, and gland of Mole, guys. So this is very important, guys. One of this may be asked as an MCQ. This sebaceous gland, this present along with the hair follicle, known as the totally is known as the pilosebaceous unit. This acne vulgaris, vulgaris means the most common, okay, or acne rosacea, guys. Okay, that is aggravated on sunlight and other things, guys. Okay. Now coming on to acne rosacea and acne vulgaris, guys. Okay, so what is important? We'll talk about the acne rosacea and acne vulgaris, guys. Okay, see, I talked about, if you talk about the lesion on the face and red color, we gave three differential diagnoses. Okay, rash, red color on the face, guys. Remember, that was SLE, that was rosacea, and that was dermatomyositis. See, SLE rash is a typical butterfly shaped rash, and it is photosensitive, means it will aggravate on light. Erythema is fixed, and this spares the nasolabial fold. You may see, guys, nasolabial fold is not spared. Okay, and it will have systemic manifestation, that is 4 out of 11. Okay, melasma is not a DD. Why? Because melasma is brown in color, guys. So it was a DD for brown color, that melasma and chick sign, okay, on the face. Now coming on to the rosacea, see, you may see there is hypertrophy with dilated means mode of blood flowing. Hence this is rosacea, and it shows potato nose, rhinopyma. Now coming on to the rash on the face. Okay, this is reddish to purplish rash. Okay, this is dermatomyositis, that is heliotrope rash. Also you remember we talked about two more sign. One was the Sol sign on the back, and one was the Gottron papule on the fingers, guys. Okay, now see, acne rosacea. What is the cause of acne rosacea? That is Demodex folliculorum. This is normal commensal, guys. Okay, see, side convexities of the face are involved, guys, means the angles are involved. Types, most common type is erythema telangistic type. You can see it appears more red, erythema. So this is the most common type. Okay, and this aggravates with heat means sunlight. Patient will give a typical history, guys. Okay, now coming on to the acne vulgaris. So vulgaris in dermat means the most common type of anything, guys. Okay, if you talk about how does it, this is due to the increased proliferation of propionibacterium acne, guys. Okay, so see, what is the clinical feature? So the lesions are polymorphic, means they may show scaling also, they may show nodules also, they may say papules also. See, they may be papule, nodule, pustule, cyst and abscess. Most characteristic one are the comedons. So there may be white comedon or maybe open comedon. If there are open comedon, means air will go inside, it will turn black, that is black comedon. White are the closed comedon, guys. So there are 4 grading of acne: grade 1, grade 2, grade 3, grade 4. See, grade 1 is mostly comedon, just white or black comedon would be seen. Grade 2 will be papules would be seen, guys. Okay, grade 3 pustules would be seen, guys, and grade 4 is the nodulocystic acne, known as severe acne or the nodule, because nodule, cyst, abscess, anything can be seen. Okay, there are some of the variant of acne, guys. Okay, acne fulminans means F for fulminans, F for fever induced acne, acne ex coriae associated with OCD. Okay, guys, then you have drug induced acne, means after taking the drug you have the acne. So isoniazid is the most common drug in India, and most common drug in the world is the steroid. Okay, guys, so that, guys, now coming on how will you treat acne vulgaris, guys. Okay, see, acne vulgaris, how do you treat it? So you have topical drug and systemic drug. Topical is clindamycin, benzoyl peroxide and retinoids. Okay, guys, like tretinoin, isoretinoin, guys. Now for systemic, guys, we have doxy and minocycline, guys, that belongs to the tetracycline family. So side effect is photoonycholysis. Okay, and there may be pigmentation of the skin nails, guys. Okay, see, this is very important. What is the drug of choice for pustular psoriasis, guys? Remember, this pustular psoriasis belongs to which grade, guys? It belongs to grade 3, guys. Okay, so this is the acetretin is the drug of choice for pustular psoriasis. And if we talk about isotretinoin, that was a retinoid. This is the drug of choice for grade 4 nodulocystic, or we have acne conglobata. This is the most severe type of acne, guys. So if you have severe acne, you use isotretinoin, guys, and dose is 0.5 to 1 mg per kg body weight, guys. Side effect, it will lead to dryness of the mouth, guys. It can lead to teratogenic, and most severe side effect is the diffuse interstitial skeletal hyperostosis. Okay, but what is the problem with acetosis, means acetretin? It is teratogenic, and the teratogenic, it lasts for more than 3 years after stopping the therapy, guys. Okay, so see, you have also chemical peel. So when you have excess of pigmentation, you can go for chemical like melasma, brown color pigmentation, acne scars. Okay, so what are the, like, you can use pyruvic acid, you may use salicylic acid, you may use trichloroacetic acid, you may use the Jessner solution that contains SLR, that is salicylic acid, lactic acid and resorcinol, guys. Okay, see, so we have talked about almost everything that we need. Now we will see few one-liner, guys, and few image-based question that may come from the dermat aspect, guys. See, now coming on to the few most important one-liner, guys. We have read many things. If you have not read something, guys, I'll take it. Just revise with me, guys. See, coral red appearance on wood lamp examination is seen in erythrasma, that is caused due to Corynebacterium minutissimum. Okay, guys. See, pityriasis versicolor also shows wood lamp positive, and wood lamp, it is done at 365 nanometer. Okay, guys. See, Then what is important, guys, here? White colored appearance is seen in vitiligo, guys. Okay. And pityriasis versicolor, that is dull yellow color. Now coming on to the nail finding, guys. See, we have read most of the thing. See, if you talk about that pterygium of the nails, that is seen in lichen planus. Half and half nail, also known as Lindsay nail, seen in chronic renal failure. Koilonoikia, that is spooning of the nails, guys, that is seen in iron deficiency anemia. Paranoikia, that is seen in fungal infection. If we talked about acute, that was psoriasis, guys. If we talked about chronic, guys, that was candidiasis, guys. Okay. If we talk about now periangular fibroma, seen in tuberous sclerosis, and this Aldrich Mitch line is seen in arsenic poisoning, guys. Now thinking about the disorders of pigmentation, guys. So see, when do you see hyperpigmentation, like in Addison syndrome, Cushing syndrome, you see, and freckles and other thing, guys. Hypopigmentation, vitiligo, guys. See, sarcoidosis, scleroderma. Okay. Now some of the important diagnostic tests, guys. Sank smear, used for diagnosis of herpes lesion, guys. Okay. This patch test is used for contact dermatitis, to know what is the cause, what is the allergen, guys. Okay. See, now if you talk about what is the most common site on the dorsum of hand or finger, guys. Okay. And most common type, Velurica vulgaris, because it is the most common type. See, if you talked about HPV, there are two strain. Okay. Low risk and high risk, guys. Low risk are, guys, 6 and 11, and high risk is, guys, 16 and 18, guys. Okay. So condyloma acuminoida. And what is the treatment of choice? That is cryotherapy or laser, guys. Now impetigo. So impetigo, what it is basically due to staphylococcal infection, guys. Okay. So this is the most common bacterial infection, and there are honey colored cysts around the face and the lips, guys. Okay. And this is due to psoriasis. Now pemphigus. Most common type again, guys, as always, pemphigus vulgaris. Rarest type, pemphigus vegescens. We talked an important point, that was it showed us eosinophilic microabscess, guys. Okay. See, diagnosis is by Zhang test, guys. Okay. And Fishnet's pattern of immunofluorescence, we have already talked. This bullous pemphigoid, we have talked, this is due to BPAG, bullous pemphigoid antigen 1 and 2. Now coming on to dermatitis herpetiformis, guys. Okay. See, it is associated with HLA-B8, guys. Okay. And this dermatitis herpetiformis, the treatment of choice, drug of choice is Dapsone. D for dermatitis herpetiformis, D for Dapsone, guys. Okay. See, we talked about pityriasis rosea, pityriasis versicolor, also known as tinea versicolor. See, what we'll read. This pityriasis rosea, okay. So this shows herald patch appearance or the fur tree appearance. So the lesion appear like this, guys. Okay, usually over the trunk or the upper arm, guys. This pityriasis versicolor caused by Malassezia furfur. Okay, we have a typical appearance known as the spaghetti and meatball appearance for non-vegetarian lover, and for vegetarian lover the appearance is known as banana and grape appearance on KOH mount, guys. Okay. See, for atopic dermatitis, okay, what is the atopic dermatitis? Name involved that this is due to a named genetic predisposition, that is atopy. It is Danny Morgan fold, guys. Okay, Danny's line, guys. Okay. Then see, what is the most common cause of airborne contact dermatitis in India? Is allergic contact dermatitis due to plant Parthenium, that is wheatgrass, guys. Okay. See, now coming on to the other important points, guys. Okay. See, now coming on to Pseudomonas aeruginosa is the most common cause that causes erythema gangrenosum, guys. This is important, guys. Okay, erythema nodosum. Remember, guys, NO for no cause, idiopathic, D for drugs, S for streptococcal infection, M for mycobacterial TB and mycobacterium leprosy, guys. Okay, see. Now infection of the foot, then Bu's line is seen in psoriatic arthropathy, guys. Okay, and this Max Joseph space are seen in lichen planus, guys. Okay. Now coming on to the important drug of choice, guys, that we need to remember. See, drug of choice for syphilis. Remember, guys, syphilis kit 3, that was white in color. Benzathine penicillin J, 2.4 million unit, guys. Chancroid soft sore caused due to Haemophilus ducrei, treated with azithromycin, guys. Lymphogranuloma venereum, that was doxycycline or erythromycin, guys. Okay, for donovenosis against azithromycin, guys. And for acne, we remember if it was a severe grade of acne or the grade 4, or so we use isoretinoin. Hence for pustular acne, guys, the drug of choice is retinoin, guys. Okay. Okay, now acitretin is the drug of choice, guys, for guys, acitretin. Now coming on to the leprosy, guys. Okay. See, for leprosy, we have satellite lesion in borderline. So how can you remember? You can remember Banta and Santa. So BT, borderline tuberculosis, shows the satellite lesion. This borderline leprosy, okay, this will show inverted saucer shape appearance. Okay, guys. Now coming on to the LL, that is lepromatous, that is the worst grade of leprosy, guys. Okay, so this is in according to the Ridley-Joplin classification, guys. Okay, guys, so you have 5 grade in Ridley-Joplin. Yeah, so lepromatous leprosy is the worst grade. Okay, so see, most common involved now is the ulna. So how do you treat a case of leprosy, guys? So depends on whether it is paucibacillary leprosy or the multibacillary leprosy. If it is paucibacillary leprosy, guys, or if it is multibacillary, initial guidelines guidelines before said that this multibacillary leprosy is treated with 3 drugs while the paucibacillary with 2 drugs. Now we have done for 3 drugs we are given according to the recent guidelines. Okay, see, if you talk about rifampicin, that is 600 mg once a month. Okay, so if you are giving once a month, guys, so you can take under supervision, means supervision. Now talking about dapsone, D for dapsone, D for daily, means you will give 100 mg daily. So 100 mg daily. So when you are taking on the first day, take under supervision. Then after that, take alone at home, guys. Okay, from day 22 to day 28. Okay, now if we talk about clofazimine, guys. Okay, so we take 300 mg once a month under supervision. Then we take 50 mg daily, guys. That is under ourself. Okay. Now talking about the paucibacillary leprosy. See, just we have removed the clofazimine, guys. Okay, according to the old guideline. If there is single lesion paucibacillary leprosy, so you have a treatment known as the Rome therapy, rifampicin, ofloxacin, and minocycline, guys. Okay. Now talking about the scabies, guys. So scabies is caused by sarcopterysis scabies var hominis, guys. That is known as the itch mite, guys. Okay, so there is superficial boros by guys, intense pruritus and secondary infection. And drug of choice, if you talk about, that is 5% permethrin, guys, and oral or systemic, that is ivermectin. Okay, guys, so now from here we will talk about the most important, like it's around one liner, guys. Just revise along with me, see how much we know. We'll see and we'll add the point that we have not read yet. Okay, see, Berkeley's membrane, I said, is this seen in auspice sign psoriasis when you try to remove the skin. Photosensitive rash is common with erythropoietic porphyria. You know there are types of porphyria. Okay, so this is common with congenital erythropoietic porphyria, that is CEP, guys. Okay, vitamin, that malaria rubra. Okay, so which vitamin will prevent it? That is vitamin C. Malaria was due to eccrine gland, guys. Okay, apple Johnny nodules is seen in lupus vulgaris, and sarcoidosis also may be seen in leishmaniasis, guys. Okay, non-cicatrizing alopecia. Non-cicatrizing alopecia is seen in psoriasis, guys. Okay, now see, now it is the commonest site of SLE. It was on the face, that is exposed to the light. Okay, see, where does scabies form? Scabies is intense itchy lesion that was due to sarcopterysis, and it is formed in the stratum corneum, that is in the superficial layer. Okay, guys, most common type of scaring alopecia, that is androgenic alopecia, that was Hamilton and Norwood classification in man. Then tuberculitis is seen in lichen sclerophrosium. Okay, drug of choice for pustular psoriasis, that is methotrexate. See, guys, heliotrope rash, remember it is seen in dermatomyositis. Other signs are the Sol sign and the Gottran papule, guys. Auspice sign is seen in psoriasis. Chronic plague type of psoriasis is the most common type of psoriasis. Okay, acrodermatitis enteropathica, that is zinc autosomal dominant, that is due to zinc deficiency, SLC39A4 mutation, guys. Okay, see, these Gottran patches are seen in dermatomyositis, we have read. Now mutation in keratin 1 and 10 is seen in epidermolytic hyperkeratosis. This is not important, guys. Okay, now coming on to the phrynoderma. Okay, this is also known as Todd skin, guys. Okay, this is seen due to vitamin A deficiency, guys. Okay, now coming on to the other things that are important, guys, that is, see, what are the findings? Pemphigus will show acantholytic cells, guys. Okay, see, varicella and herpes will show multinucleate giant cell, guys. Okay, see, alopecia, we have talked about androgenic alopecia is the most common type, that is due to androgen dependent. The main culprit is the dihydrotestosterone. Treatment is 5% minoxidil and 5-alpha reductase inhibitor type 2 known as the finasteride, guys. Okay, then anagenic effluvium we have shown loss of hair due to chemotherapy, and telogen effluvium we have shown after a chronic illness, guys. Okay, and trichotillomania is a psychiatric disorder which is impulse control disorder we have talked about, guys. Now talking about the pityriasis versicolor known as the tinea, guys. It is due to Malassezia furfur, and most common they present with hypopigmented patch. You remember in white lesion, guys, we talked about pityriasis versicolor, the tinea. On examination with the wood lamp, guys, you will see a fluorescence, guys. Okay, And I talked about the appearance. For the non-vegetarian, it's spaghetti and meatball, and for vegetarian is banana and grapes appearance. Treatment is whitefield ointment and imidazole derivative. Now coming on to the candidiasis, which is also known as moniliasis. So candidiasis is caused due to Candida albicans, so guys, which is a yeast-like fungus, guys, and it is more common in immunocompromised stage, diabetes, pregnancy, guys. So there is a white curdy patch. Okay, if you think about the discharge, guys. Okay. It can cause, I think about, we talked. For chronic, most common causes candidiasis, and for acute it was asorius, guys. So now talking about the tinea capitis. Okay, so tinea capitis is see, there are three species: trichodermophyton, epidermophyton, and microsporum, guys. Okay, see. Now coming on to the hyperpigmentation, we have talked about melasma, that was due to OCP. We have talked about the malar rash, SLE, butterfly rash, guys. Okay, see, acne rosacea we have talked about, and the parasite involved is the Demodex folliculorum, guys. Okay, now talking about the other important, like impetigo, also known as pyoderma, caused due to staphylococcal infection, that is honey colored crust on lesion after healing, guys. Staphylococcal scalded skin syndrome, oral lesion are absent and the systemic involvement is rare, guys. Patient will present with fever, guys. Toxic epidermal necrolysis, we have some drugs that can cause, that is phenytoin, penicillin, NSAIDs, barbiturates, guys. Now coming on to the bacterial infection. See, furuncle, there is abscess formation, that is due to S. aureus. Carbuncle, that is multiple furuncle, they fuse to form a carbuncle at the nape of the neck. Most common cause is again S. aureus. Cellulitis, that is infection of the skin plus the subcutaneous tissue, and most common cause is the Streptococcus pyogenes, which is a beta hemolytic streptococci, guy. Now coming on to the other one, that is syphilis. See, syphilis, remember, that has incubation period of 9 to 90 days. It is caused by Treponema pallidum. Syphilis was painless ulcer with painless lymph node, guys, and it causes a hard chancre, guys. Okay. Secondary syphilis, see what are, remember. There may be condyloma lata and there is moth eaten alopecia, guys. In tertiary syphilis, guys, on dark ground microscopy you diagnose, and the first test that become positive is the FTA ABS, guys. And how do you diagnose it? That is VDRL positive, guys. Venereal disease research laboratory test positive. Now coming on to the chancroid, that was due to Haemophilus duigre, painful buve, and there was school of fish appearance and the railroad track appearance, guys. Now coming on to the lymphogranuloma venereum, guys. We have read everything. So group sign is important, painful is important, and it causes is thiamine, guys. Okay. Now coming on to the skin malignancy. This basal cell carcinoma, it's more common in the exposed part, guys. Okay. And where do you see the basal? The most common site is in the inner canthus of the eye or in front of the ear, guys. Okay. And this is also known as rodent ulcer because it erodes the skin, guys. Now coming on to the connective tissue disorder, dermatomyositis, you will find anti-endothelial positive, and we have three things: heliotrope rash, Gottron papule, and salt sign positive, guys. Okay, now see, lupus pernio is seen in sarcoidosis. Okay, guys, this is important, guys. This erythema migrans, that shows target sign, that is seen in Lyme disease or Borrelia caused due to Borrelia bird dog free. Okay, guys. Now erythema infectiosum, also known as fifth day disease, slap cheek appearance caused due to parvovirus B19, guys. And this incognita pigmenti, this is a X-linked dominant disorder. This may be asked in MCQ, guys. And this is pigment is there in the line of Blaschko. Okay, hence also known as Bloch-Sulzberger syndrome, guys. See, guys, now coming on to the other important one-liners, guys. Butterfly rash, SLE. Okay, drugs causing acanthosis nigricans, nicotinic acid. Target lesions in erythema multiforme. Okay, guys. Causative agent of chancroid, Haemophilus duigre. Important features of psoriasis scale, that they are present silvery micaceous scales, guys. Okay, that are present more on the extensor surface, guys. Most important criteria for diagnosis is leprosy, that is the slit skin smear for diagnosis of leprosy. Minimum treatment of leprosy 12 months, guys. Slit skin smear is negative in neuritic type of leprosy that involves only the nerve, guys. Comedones are characteristic of acne vulgaris. There were two types of comedone, black comedone and white comedone, guys. Most common cause of pemphigus vulgaris. Okay, see, melanocytes number are reduced except albinism. Okay, see, in a now coming on to the other important thing that is important. See, apple jelly nodules in lupus vulgaris. Chirion is the form of fungal infection that involves a boggy swelling on the scalp, guys. Okay. See, flag sign. It is seen in kwashiorkor, guys. That is seen in protein energy malnutrition. Hemophilus ducrei causes chancroid. That is actually a soft chancre, guys. Mycosis fungoides, that causes cutaneous T cell lymphoma, guys. And what do you see? M is not for M, means it will show P wala abscess, guys. Okay, guys, do you remember? So it shows the presence of abscess. Alopecia areata. I said this is a type of, guys, non-scoring alopecia. So they have a spontaneous recover. This cradle cape in babies is seen in seborrheic dermatitis, guys. Leprosy will affect all organ except, guys, this is important. This is MCQ uterus. Fry's test is seen in lymphogranuloma vinodum and it shows groove sign positive and it shows is thiamine positive, guys. Okay. What is the causative agent for common wart? That is human papilloma virus, guys. Okay. And then skin condition treated with PUVA, that is psoriasis plus UVA, that is psoriasis. Munro microabscess in psoriasis, guys. Okay. Treatment of psoriasis, that is methotrexate or psoriasis plus UVA. Auspicide is seen in chronic plague type of psoriasis. Okay. So this is important. Recurrent painful orogenital ulcer with arthritis, that is HLA-B51 associated, guys. Okay. This is important. This I talked about the triads in dermatology. If you have not watched, guys, go and check out the page and watch it, guys. Okay. Pitting of the nails. If we talk about the regular pitting, it is in alopecia, and irregular pitting, guys, in we see in psoriasis, guys. Okay. Tinea versicolor is due to Malassezia furfur. Heliotrope rash is seen in dermatomyositis, guys. Okay. See, if there is scaly macule on the cheek, guys, and hypopigmented 5-year, what do you think? Pityriasis alba, guys. No more thinking, guys. Okay. See, mouth lesions are seen in lichen planus, Wickham's striae. Remember, guys, scabies in scabies bureau level is at the stratum corneum, guys. Okay. Now coming on to the other thing, guys. Jang test is positive in pemphigus foliaceus, pemphigus vegetans vulgaris. Okay. Things that are superficial, guys. Okay. Now see, bulla spread sign is seen in pemphigus vulgaris, guys. This we talked about. Drug of choice for dermatitis, D for dermatitis, D for dapsone. Now coming to the drug of choice for chancroids is either azithromycin or erythromycin, guys. Okay. For systemic candidiasis, it is amphotericin B. For herpes zoster, it is acyclovir, guys. Okay. Now coming on to the other things. Okay. Earliest sensation to be lost in leprosy. Thermal sensation is lost earliest. Okay, guys. Now coming on to the phases of hair. See, rhinopyma, we talked about the potato nose. Okay. Acne rosacea, guys. Anagen phase was the first phase, that is the growing phase. Yeah. Okay. See, guys. If we talk about the sequence of cell cycle, that is G0, G1, S, G2, M, guys. Oil drop sign, that is pathognomic of psoriasis. But most common finding, guys, it is the oil drop sign, guys. Okay. Now coming on to the Christmas tree appearance seen in pityriasis rosea, guys. Okay. Alopecia areata treated by minoxidil and finasteride, which is a 5-alpha reductase inhibitor type 2. Skull of fish appearance in Haemophilus ducrei. Raindrop pigment seen in chronic arsenic poisoning, also Aldrich Meech lines, guys. Okay. Now patch test is done for allergic contact dermatitis, guys. Okay. Least common site of involvement in psoriasis is the CNS, guys. This seaweed body, these are the apoptotic body, guys. These are I have talked about in the pathological bodies video, guys. Go and check it out. This dobesis is seen in Tinea cruris. Spongiosis, that is collection of fluid, okay, water, that is seen in acute eczema, guys. Okay. This commonest metal causing hypersensitivity is the nickel, guys. And most common cause of airborne contact dermatitis in India is the Parthenium grass, guys. Okay. See. Now, herald patch is seen in pityriasis rosea, guys. We have read. Diarrhea sign is seen in urticaria pigmentosa and pseudo-diarrhea sign in smooth muscle hematoma, guys. Okay. Now coming on to the ash leaf macule, that is seen in tuberous sclerosis. We saw TSC1 and TSC2 gene mutation, guys. Patch test reading is read after 48 to 72 hours and it is a type of type 4 hypersensitivity, that is delayed hypersensitivity, guys. Okay, Koebner phenomenon means along the line of scratch there are new lesion, that is seen in psoriasis, lichen planus and warts, guys. Okay, lesion in the mouth in lichen planus known as Wickham's striae, guys. What is pruritic? Lichen planus is intensely pruritic, guys. Okay, now see, row of tombstone appearance, that is seen in pemphigus vulgaris, because there was a suprabasal split just above the stratum basal. It has got a split, so it looks like a row of tombstone appearance, guys. Okay, see, now coming on to the increased level of IgE, that is eosinophil, that is seen in atopy. IgA deposition seen in dermatitis herpetiformis. Dermatitis herpetiformis shows HLA-B27 positive, guys. Target lesion seen in erythema multiforme. Molluscum contagiosum caused by pox virus, guys. Okay, then now coming on to the other things that is seen, guys, that you have IgA deposits on skin biopsy, inositol purpura. Triad of Ritter syndrome, guys, we already talked about. Pseudobobo-donovenosis caused by Donovan bodies are seen here, guys. Okay, satellite lesions are seen in Santa Banta, guys. Casel's neck rest, that is due to pellagra. Okay, guys. Then now coming on to the commonest nerve involved is the ulnar nerve, guys. This rose spots are seen in typhoid fever, guys. This virtuo cells are seen in leprosy, guys. And this lepromin test is used to tell about the prognosis, guys. Okay. See, permethrin is used for scabies, guys. Okay. See, leprosy involve all organ except the uterus, guys. We have talked about this, guys. Okay. This safety pin appearance is seen in donovenosis granulomatous, guys. Grisopulvin is not used for tinea versicolor and candida. Circle of fibra is with scabies, guys. Okay. So, guys, read about this once. Pause it. So, everything like almost I have discussed, guys. Just go. If I missed out something, guys, read about this from here, guys. Okay. Now coming on to the important image based, we'll rapidly wrap up within next 10 minutes, guys. Okay. See, psoriasis, you have silvery scales and well defined plaque, guys, mainly on the extensor surface, guys. Do you see? Now coming on to the psoriasis, it shows auspice sign positive, guys. See, you can see the auspice sign positive. When you scale it, it is positive. Along the line of scratch there are new lesions, that is Commoner's phenomena, and you see a hypopigmented ring around it, that is known as One-Knopf's ring, guys. Now coming on to the gutted psoriasis, this is known as raindrop psoriasis, guys. Okay, so it looks like a small raindrop, guys. Okay, so it is associated with streptococcal infection, guys. Okay, treatment erythromycin treatment is indicated, guys. Okay, now coming on to the pustular, if there is generalized pustular psoriasis of pregnancy, this is known as von Jumba's disease. It is characterized by lake of pus appearance, guys. Okay, it is precipitated by if you withdraw systemic steroid. And what is the treatment of choice, guys? It is acitretin, methotrexate, and sorelin plus uva, guys. Okay. Now coming on to the nail psoriasis. I said nails are involved, and the most common finding is the pitting of the nail. But the pathognomic finding is the oil drop sign, guys. See, pitting, random irregular pit, guys. Okay. Onycholysis and oil drop sign positive, guys. And it shows subungual hyperkeratosis. Okay. See, if you see the psoriasis associated with arthritis, that is HLA-B27 positive. It is asymmetric oligoarthritis, guys. And it involves the DIP, the most characteristic. Okay. Now, and it shows the penicillin cup. See, how can you remember? Psoriasis. P for penicillin cup deformity, guys. Okay. S for sausage shaped disease, guys. O for oil drop sign, guys. That is pathognomic. Now coming on to the histology in psoriasis. See, we will see parakeratosis, guys. We will see the Munro's microabscess because P is not for P, guys. Okay. We will see their hypogranulosis. Okay. Westep hypergranulosis is seen in lichen planus. And we'll see spongiform pustules of Kogos, guys. Okay. See, and what is the reason for this auspice signs to be positive? This is basically the suprapapillary thinning. So the suprapapillary region is thin. So when you try to scratch the lesion, it starts to bleed, guys. Okay. Now coming on to the lichen planus. So see what happens. Lichen planus cobrization is positive, guys. Okay, and it involves the mucosa and the nail, guys. Okay. So what are the 5 P's? Purple, pruritic, polygonal, plain top, papules, plaques. Okay, guys. And there is Wickham's striae, guys. I said, and this involves the flexure. Okay. So if you talk about the mucosa lichen planus, you see a reticulate pattern, that is more. This is known as Wickham's striae, guys. Now coming on to the next one, guys. Okay, that is nail. So you have longitudinal ridging in the nails, guys, and there is dorsal terism, guys. Okay. See, there may be scalp lichen planus or lichen planopyralis which shows footprint in snow appearance, guys. Okay. So what are the histology finding? There is hyperkeratosis without parakeratosis. It becomes thin, but nucleus is not present. So this term is also known as orthokeratosis, guys. Okay. and there is a wedge-shaped hypergranulosis, guys. There are civet or colloid apoptotic bodies that are seen, guys, and Max Joseph space is seen here, guys. Now coming on to the pityriasis rosea, that is due to HHV7, that is herald patch is seen, guys. Okay, that is the mother patch is known as the herald patch, guys. Okay, and you see typical Christmas tree appearance with a collarate of scale appearance, and secondary syphilis is a DD. Okay, so say you can see pemphigus vulgaris. Remember, guys, pemphigus vulgaris, it causes suprabasal split, involves DSG1 and 3. Okay, Nikolsky sign. Okay, and what happens that there are blister formation, guys. You may have a look at the blister, guys. Okay, so pemphigus vulgaris, jank smear characteristic acantholytic cell. There is suprabasal split with acantholysis known as row of tombstone appearance, guys. This is only row of tombstone appearance, guys. Now coming on to the pemphigus vulgaris, what are the other finding? IgG and C3 deposition in a fishnet pattern, guys. Okay, now coming on to the other disease, that is Haley disease. So Haley disease, it is due to defect in calcium channel, that is autosomal dominant. So Haley ATP2C1, okay, is the gene mutation problem, guys. ATP2C1. Okay, and on histopath, you remember what we discussed, that was dilapidated or brick wall appearance. Now coming on to the bullous pemphigoid, this is located deeper down, hence the bulla are tense, guys. Okay, it is due to BPAG1 and 2, guys. Okay, and okay, guys, so bullous pemphigoid, Zank smear, there is no acantholysis because it is very deeper down, and it is subepidermal blister, guys. Okay, this bulla pemphigoid, it is a linear deposition of IgG and C3, guys. This linear IgA disease, okay, so linear IgA disease will show cluster of jewels appearance, guys. Cluster of jewels, you can see the photo, guys. Now so histopathology resembles the dermatitis herpetiformis or the bullous pemphigoid, and there is linear IgA deposition, guys. Now this dermatitis herpetiformis, there is grouped papillovesicles that is mainly located on the extensor aspect, guys, like elbows, knee. Okay, so dermatitis, there is neutrophilic microabscess that is known as papillary tip microabscess, guys. Okay, and there is a history of gluten sensitivity, guys. Okay, so now coming on to epidermolysis bullosa acquisita, just remember it is due to the defect in mutation collagen 7, guys. Okay, so and so you know we have three types: epidermolysis bullosa simplex, creatine 514, junctionalis, that is laminin 5 for alpha 6 beta 4, and dystrophica, that is dystrophic collagen 7. Okay, now contact dermatitis. Okay, so there are some irritants that may irritate the skin, like water, soap, solvent, detergent, guys. Okay, housewife's eczema. Okay, now coming on, we do a patch test for dermatitis, that is type 4 hypersensitivity, and most common metal causing contact dermatitis is the nickel, guys. Okay, then ACD, that is airborne contact dermatitis. What is the most common cause? That is Parthenia, most common cause in India, guys. Okay, now talking about the atopic dermatitis. So there will be a history of infant and there would be family history of atopy, guys. Okay, so if we talk about the atopic dermatitis, there is lateral thinning of the eyebrow, guys. Do you note, guys? This is known as Hartog sign. Also we have a Danny Morgan fold, guys, under the C. This is the Danny Morgan fold, guys. Okay, see, now if we talk about the other DDs, that is pityriasis alba. So you can see there is a presence of hypopigmented lesion, guys. Okay, and also history of atopy is present here, guys. Okay, now coming on to the other important thing, guys, that is seborrheic dermatitis. So seborrheic dermatitis shows a distribution on the scalp face area, guys, seborrheic area, and it shows in infant cradle cap sign. This is important from MCQ aspect, guys. Okay, now talking about the asteatotic eczema, that shows crazy paving appearance, guys. This is not very important. Okay, okay, guys, so now talking about the chancre, that is the clinical picture. Okay, so this is the photo of a chancre. So chancroid caused due to Haemophilus ducrei, guys. Okay, and it shows a giant chancre, guys, that is painful ulcer, and it okay, guys, see, it's painful. Okay, herpes genitalis, because there is the presence of the group lesion, guys, so that is herpes, guys. Okay, then this is the groove sign, guys. Do you see there looks a groove, guys? So this is the groove sign that is seen in lymphogranuloma venerum. This is the granuloma inguinal. So this is painless ulcer with no lymph node, guys, in this case, guys. Do you see? And it bleeds on touch, guys. Okay, now coming on to the other images, guys. Syphilis, secondary syphilis, how will it present, guys? It will present with Buske-Ollendorff sign is positive, guys. That is rebound tenderness. This is important from the MCQ aspect, guys. Okay. So syphilis, if we talk about secondary, there is generalized lymphadenopathy, guys. There is snail track ulcer in the mouth and condyloma accumulator. Condyloma lata is there. Okay, guys. Now talking about the urethral discharge, Neisseria gonorrhoeae. We already talked about the Neisseria gonorrhoeae in the rapid bacteriology revision session, guys. Go and watch those, guys. Okay. So how do you diagnose it? There is gram-negative cocci, guys. Okay. And culture, you have transport media as the Stuart and the Ames media, and the culture media is the Thayer-Martin and the modified Thayer-Martin media, guys. And treatment is the third generation cephalosporin, that is ceftriaxone, guys. And syndromic management, it comes in the gray kit, that is kit number 1. That so that involves 2 drugs, that is azithromycin and ceftriaxone, guys, cefixime, guys. Okay. Cefixime. Now genital what, that is condyloma acuminata. Lata is due to syphilis and acuminata is due to HPV. 6 and 11 are the most common cause, guys. Okay. Now coming on to the TT. Okay, if we talk about the tuberculoid leprosy. Okay, lesions are less in number, guys, and it's localized. Okay, so this is known as right saucer up appearance, guys. If we talk about Banta, then you remember Santa. So what do you see? There is the satellite lesion, guys. See, around the lesion you see satellite lesion, guys. Okay, now coming on to the borderline. Okay, if we talk about the borderline, guys, so there are punched out appearance. If you look at the appearance, that is Swiss cheese or the punched out appearance, guys. Do you see? Now coming on to the lepromatous, that is the severe form of leprosy. So there are numerous skin lesions, guys. Okay. Now coming on to the lepromatous leprosy. So if it involves the entire face, it may also be known as leonine leprosy, guys. Okay. See, loss of lateral part of eyebrow known as lateral madadosis, leonine faces and depressed nasal breeze, guys. Okay. So there may be nasal symptoms, guys. Okay, if we talk about the variants of leprosy, there is Lucio leprosy, that is an histoid leprosy. Lucio leprosy is also known as bonita leprosy or beautiful leprosy, guys. Okay, so this is a variant which is useful seen in the Mexico. This is important from MCQ aspect, guys, for like INS set and other thing. Okay, then we have histoid leprosy, guys. Okay. So see, in leprosy there may be deformities, guys. Ulnar nerve paralysis is most common, guys. Okay. See, then there are two types of lepra reaction, type 1 and type 2. Type 1 will cause type 4 type of hypersensitivity, guys. Okay. So this is type 1 lepra reaction, and this type 2 lepra reaction systemic features are more severe, guys, and there is erythematous subcutaneous nodule, guys, and type 2 is a type of type 3 hypersensitivity. How can you remember it? Lepra, that is 5 letter, guys. Type 1, 1 plus 4 will form 5. Type 2, 2 plus 3 will form 5. And lepra uses 5% H2SO4 as acid fast, guys. Okay. Now coming on to atypical mycobacterium. This mycobacterium marinum causes swimming pool granuloma or the fish tank granuloma, guys. This is important, and minocycline is the treatment, guys. This mycobacterium ulcer causes Buruli ulcer. This is important from MCQ, guys. Now this primary TB causes TB chancre, guys. This is fine. The secondary TB lupus vulgaris, guys. This is important. Face area is involved, guys, and it shows the presence of apple jelly nodules on dioscopy, guys. Okay, then tuberculous varicose cutis. This is also known as anatomist wife. This is secondary reinfection to TB, guys. See, you can see the warty appearance of the lesion, guys. Okay, then screwphlorodoma. This is the most common cutaneous TB in India, guys. Okay, then this is not important, guys. Now coming on to the other thing, erythasma, that is due to Corynebacterium minitissima. It will say coral red fluorescence under wood light, guys. This is important. Pityriasis versicolor, that is the presence of hypopigmented lesion, guys. Do you see? And it shows spaghetti and meatball, or you may also know known as the banana and grapes appearance, guys. Okay. Now talking about the Tinea nigra. So Tinea nigra is due to the fungi infection, palms and soul. This is not very important. If you talk about the piedra, there is white piedra and the black piedra. If we talk about white piedra, white means bijli. That is Trichosporum bigeyi. If you talk about the black piedra, black means hot. It has turned dark in color. That is, black piedra is very hot because adherent. Why? Because it has passed through hard phases of life, hot. And white piedra, who has got everything in life superficially, they are easily detached, guys. It may show ectothrix and endothrix, guys. Okay, so this is the black dot tinea, that is endothrix, guys. Okay, that is due to tonsillense and violaceum, guys. Okay, and gray patch is the ectothrix, that is due to microsporum, guys. Then chirion. Chirion is the boggy swelling on the scalp, guys. Okay, now coming on to the, guys, other thing, that is phabus. So phabus shows the presence of a honeycomb crust that is known as scutula, guys. Okay, Now coming on to the tinea faciae or barba, if it involves the face or the beard area, guys, hence it is known as and tinea incognito. If after taking the steroid the pictures are not as it should be, it is known as tinea incognito. Then tinea crudis, that is synonym to jock itch or the dhobi itch, guys. Okay. Now coming on to the tinea manum, if it involves the hand, guys. Tinea pedis, if it involves the atlas foot and it is caused by mantegrophyte, guys. Okay, onychomycosis, that is due to tinea in unguum. Okay, guys. So it may be due to Asorius or maybe due to Candida. Candidiasis. So candidiasis, what is it? So it shows the presence of pseudohype, guys, on KOH mount, guys. And treatment, how will you? Amphotericin B is the treatment of choice. Sporotrichosis caused due to sporothyrex is canchi. There will be typical history of Rose Gardner, hence known as Rose Gardner disease, guys. And the lesion present in a along the line of lymphatic in a linear configuration, guys. Okay. And how do you treat it? You treat it with a solution of itraconazole or potassium iodide, guys. This is important, guys. Okay. Now coming on to the other one, that is pedocolosis corporis. Okay, guys. So basically this is seen in overcrowded dirty situation, guys. Okay, so if it involves the pubis area, that is known as crab louse or pithris pubis, guys. Okay. Then pediculosis pubis, guys. This is also similar, guys. Okay. See, this cutaneous leishmaniasis, guys. Okay, so vector is the sandfly, that is phlebotomus, guys. Okay. Now coming on to the post-calendar dermal leishmaniasis, that is due to Leishmania donovani. It developed many years after incompletely treatment, guys. Okay. See, now if we talk about the dioscopy finding, apple jelly nodules, okay, lupus vulgaris, okay. Diarrhea sign is seen in urticaria pigmentosa. Gratis test and auspice sign, guys, we have already we have Candleback skill, Berkeley membrane and auspice sign positive. Okay, guys. Nikolsky sign is an indicator of active acantholysis, guys. Okay, it distinguishes between intraepidermal and the subepidermal disorder that is located superficial, like pemphigus vulgaris and foliaceus, staphylococcal scaly skin syndrome, guys. Okay, then this is buttonhole sign. Okay, this is seen in neurofibromatosis 1, guys. Okay, this carpet tank sign is seen in DLE, and dimpling sign is seen in smooth muscle hematoma, that was pseudodiarrhea sign, guys. Okay. Now coming on to the Coburnus phenomenon, along the line of scratch there are new lesion, also known as isomorphic phenomenon, guys. Now coming on to the dermographism, that is seen in urticaria. Okay, guys. Now coming on to the other important thing, that is erythema multiforme, shows the presence of target lesion, guys. And erythema chronica migricans, seen in Lyme disease, guys. Okay. See, now coming on to the other important thing, that is, guys, Pityriasis rubra pallidus is a type of erythroderma and it shows islands of sparring. There will be a normal area with dark area, guys. Okay, this Reiter's disease. Okay, so this was actually B51 associated, guys, and it shows sarcinate balanitis around the glands and other thing. So you can say staphylococcal Johnson syndrome and toxic epidermal necrolysis. Dermatomyositis, there is Gottron papules on the skin. Gottron sign is seen, guys, and there is heliotrope rash. There is shawl sign, guys. Okay, so this is discoid lupus erythematosus, guys. Okay, scleroderma photo is shown, guys. Okay, and this sign is known as Coupe de Sebre sign, guys. Okay, Coupe de Sebre sign is seen here, guys. Okay, so if you see, guys, this is xeroderma pigmentosum. Okay, guys, see here you can see the presence of, guys, in this photo, Sturge-Weaver syndrome, that is the port wine stain, guys. Okay, tram track calcification. Tuberous sclerosis shows the presence of sagging patch, guys. Okay, so ichthyosis, that is fish-like scale appearance, guys. Okay, guys, hopefully I have revised the entire dermatology for you. Hope this help you, guys. Watch this, solve MCQ, and I hope you are done for your dermat preparation. Keep liking, keep share, subscribe. Thanks for watching.